Welcome back to our video series.
So today we are doing a combination treatment of SkinPen Microneedling plus Sculptra, or what I like to call Microsculpt. Okay, so this is the Sculptra, and before I begin the microneedling, I'm going to actually apply some on the skin. So Sculptra is not a typical hyaluronic acid filler that people usually get injected to add volume. How this works, it actually stimulates your body to create its own collagen and elastin. So essentially, it's going to cause the soft tissue to give that lift and diminish fine lines and wrinkles. And the reason it works by applying it after I do the microneedling is that the microneedling has these pathways or channels that are created for the Sculptra to be able to penetrate in the dermis of the skin. Otherwise, just applying it to the skin is not going to work. So it sounds a lot worse than it actually feels. And the reason I like the SkinPen model is that you're able to change the depth of the treatment. You don't want to do the entire face on the same depth. Obviously, the skin is thinner, on the forehead and under the eyes, so we can customize the treatment according to your skin type and what your desired outcome is. So I glide the SkinPen across the skin, and it's creating thousands of those micro channels. So you can see a little bit of mild erythema and a little bit of pinpoint bleeding. This is the clinical endpoint that we are trying to achieve. So you have a short window of being able to apply the Sculptra after it's treated. So I'm going to apply some more. So one of the reasons I love SkinPen in general is that it gives comparable results to a laser resurfacing without the downtime. It's a fraction of the cost, and it's safer for all skin types. It doesn't have the heat or the light element, so you don't risk getting post-inflammatory hyperpigmentation. So tomorrow she might be slightly pink. I'm going to turn you to the left slightly, and we're going to treat right up to the orbital rim. So we can essentially pull the tissue down so it treats the under eye tissue that you really have a hard time treating when you're using a laser. SkinPen is the only FDA approved device to treat acne scarring, which she doesn't have, but those of you who are wanting some acne treatments, this would be my go-to.
I have so many friends that have acne scars. They always ask me for treatment for that.
Now again, you can do this as a standalone treatment, but the benefit of the Sculptra, it just adds more of the collagen stimulation. So it's essentially having, 3 SkinPens with the one. So it's like a SkinPen on steroids. One of the most common complaints is people saying that they have dark under eye circles. And as we age, our skin thins. So that's not always a hereditary thing. It can be that our skin is so thin that it sees like the underlying muscle right there. So by doing this, it builds that collagen, and essentially the dermis is going to be thicker afterwards. Some frequently asked questions I get is how many treatments I recommend. So SkinPen, I typically do a series of 3 to 6 depending on the condition that we are treating. And you would come in once every 4 to 6 weeks. The downtime, she's going to be slightly pink today. It's going to feel like she has a mild sunburn. You don't want to apply any products on after this. Tomorrow, after 24 hours, she can wear makeup. I don't want her to use any chemical-based products, so just a very gentle skincare regimen. I'll actually send her home with what's called the rescue treatment that she's going to use 2 times daily for the next 3 days. And then, of course, just be mindful of sun exposure. for the next 7 to 10 days. So for her cheeks, I'm gonna go a little bit deeper. It's an easy transition. Another reason why I like the SkinPen is that it has this sheet that you protect it with. It's obviously safer and it won't do any cross-contamination like some of the ones, the older versions that are out there. Not only do I recommend this treatment to combat some skin conditions, but it's actually so good for preventative measures. I have a lot of 20, 25-year-olds coming in and they just kind of want to maintain, and I like to say put collagen in the bank.
Yeah.
Because as we age and battle skin conditions, the natural architecture of our skin deteriorates, so this is the perfect way to build some collagen and elastin naturally. So you can kind of see the treated side versus the non-treated side. You got just a slight erythema and edema on this side, and again, that is the clinical endpoint that we want to see.
No bleeding.
No bleeding. Another common question I get is who can benefit from this? And essentially anybody that has skin can. It's so diverse.
Yeah.
Treats fine lines and wrinkles, pore size, acne scarring, so any textural irregularities. You can also see just a more radiant glow. It actually strengthens blood vessels too. So if people have a lot of broken blood vessels or rosacea, you don't treat too deep on them, but it does strengthen that. So
yeah,
good for everybody.
You can adjust the pressure of the needles.
So if you're nervous about your first one and you kind of want to just test it out, you could do, a very low depth treatment.
Just so you can experience.
So again, applying the last of the Sculptra. I'm also going to apply a hyaluronic acid over top. It's kind of plump the skin and make it kind of soothe it.
What does the hyaluronic acid to the skin?
Hyaluronic acid is actually a natural substance your body makes. So it retains 1,000 times its weight in water. So a lot of fillers like Juvederm and Restylane, they're a hyaluronic acid base. So it plumps the skin, it adds volume. And it's just a natural, safe moisturizer to use. You don't want to use anything too stimulating after this because your skin is, of course, going to be a little sensitive. So that is the conclusion of the treatment. Nice and pink, uniform. So that means that it's all kind of the same color pink. So we treated all the areas.
Thanks for joining us, and stay tuned for more videos to come.